Now it's Dr. Ali Ramazan from Egypt, and he will speak about the Egyptian experience of hijama. Yes, please, Professor Ali Ramazan, we are listening to you.
بسم الله الرحمن الرحيم الحمد لله والصلاة والسلام على رسول الله سبحانك لا علم لنا إلا ما علمتنا إنك أنت العليم الحكيم. First of all, I like to send my gratulations to this excellent country and its people. And I would prefer, of course, to hear my professor, Dr. Abdulgawad Istawi, before me. But I will start. It is not really only Egyptian experience, but it is an old history since 35 years when I was working in Saudi Arabia in Jeddah.
They have lost your voice. Is there a problem with the internet connection?
Yes, but it is not from here. It's from Google lecture they have.
Are you hearing me, Dr. Muhammad?
Yes, now we can hear you. Please.
Okay. Thank you very much, Dr. Muhammad, for your invitation for me in this conference. Although this is only happened since 4 days, I like to say that this work is related not only 10 years, but more than 35 years. When I was working in Saudi Arabia in Jeddah, I noticed that many of my patients had marks, scratches on different positions of their body. Of course, I should ask them, what are these marks? They answered me, these are marks from hijama. The first question I said, what do you mean by hijama? Was the first time for me to hear about the word cupping or hijama. They told me it is an Prophet Muhammad sallallahu alayhi wasallam hadith. It is written in Bukhari Muslim. خير ما تداويتم به الحجامة. The best thing for treatment is hijama. It is also one of 3 things in other hadiths. جعل الشفاء في 3, pure in 3 things, between them الحجامة. I really was very surprised because this is the first time to hear. And of course I asked them, did you feel improvement? Many of them, they told me, yes, we feel very much improvement. For sure, during that time, 35 years ago, I didn't find any research in front of me about cupping therapy. I asked to see one of the oldest people or the most experienced in Jeddah, and they invited me to visit one of the most experienced one in Jeddah. I am surprised when I visited him that it is a shop, it is not a clinic. And I found some patient, either Saudi Arabian or Egyptian or from Pakistan, sitting on the ground, and this man using something in his mouth to withdraw blood from different parts of their bodies here. I really was astonished from these things, because I was afraid from getting infection either for the treater or for the other person. And I decided to not forget in hijama at all. But I surprised when I was in my clinic in Jeddah, that one of the Saudi patients entered for me and he asked me to do hijama for him. I told him, sorry, I can't do hijama. I don't know anything about it. He told me, Dr. Ali, it is very simply. He brought for me already cup and something like a blade, and he bring a broad of paper and he made firing of this paper and put it in the glass, put it over the low back region because he told me he has severe pain since 5-10 days and he took a lot of treatment without improvement. I surprised about this technique, but I completed it. After 10 minutes, he told me, please remove. I removed. He told me, thank you very much. I feel improvement now. The same condition repeated from the coach, which was working with me in Saudi Polyclinic. He told me, please, Dr. Ali, I have much low back pain. I took Voltaren injection. I made massage, but no improvement. Please help me, do hijama for me as you did for Mr. Muhammad Jamil. I was encouraged I closed my room and I repeated the same technique which I did with the first patient for my life to do hijama with him. And after 15 minutes, he told me, thank you very much, I am improved now. Really, I was surprised from the rapid improvement. That's why I was preparing MD for obesity with one of the external doctors outside the country. But I wrote for him, please, I need to prepare something about hijama because no one knows anything about it. And it is widespread in some of the small villages in our country. And I didn't find in Saudi Arabia at that time any doctor or hospital or polyclinic use hijama. I was written for him cupping and shedding of blood. He already agreed and wrote for me cupping and the bloodletting. And he sent for me some few doctors who utilizing hijama. The majority was in China and one was in Australia and one in Canada. I wrote for them. I like to prepare a thesis about hijama. They answered me, some answered, some not. They sent for me some magazine and I looked for them. I found that there are new apparatus or new equipment for using hijama. And I really starting to use the hijama. And before I come here, before 3 days, Dr. Muhammad Yusuf, he was very, very, very interested and active doctor. He likes to do some things for hijama, and he liked to encourage me. Before 4 days, he told me that he did hijama for one which has some problems in his shoulder joint, and he improved. And I remember this story because the first one which I put in my research about hijama was a Egyptian general was working in Saudi Arabia. He told me, Dr. Ali, I made 12-session physiotherapy, but no improvement. I told him, we can do hijama for you. He asked, what is hijama? The same question of mine. I told him it is one of the Prophet Muhammad sallallahu alaihi wasallam advice. He agreed. He told me, please, I have greatest pain. Try to help me by any way. I did hijama for this general, and I swear to God that he, after 2 days, he came back to the polyclinic and told me, thank you very much. I improved my shoulder, and he could raise his upper limb for the first time since 2-3 weeks. And he was very happy and said, Allahumma salli wa barik wa sallim alayka ya Rasulallah. Really, these things encouraged me to start my study about hijama. It is a long history, really. So I hope that Dr. Muhammad Yusuf give me a few minutes. I would like just to attract your attention for very important points, and I will leave all what I did registered for any question or for any future research. I tried to develop a new technique by using a big syringe in order to withdraw blood to avoid contamination to the wound. When I was in China, I really found they have excellent equipment. This equipment helped me a lot in my research. And now I will answer some few important questions very rapidly. Who can benefit from the cupping and the bloodletting or hijama? The advice of Prophet Muhammad, it is not for limited one or limited age. And also in China, they use it nearly for all peoples. And I did more than 5,000 patients, either in Saudi Arabia, the majority of my patients, and few patients in Egypt. Different diseases, the majority of them had low back pain, have headache, have knee joint, have arthritis, and have some psychological conditions. Is there any contraindication to hijama? I don't think so, not much contraindication, but please, we should take very strict medical investigation. For myself, I don't do hijama for anyone remove something, any tumor from his body, except he did the new bone scan to be sure that there is no any widespread of the original tumor. Even he was told me that he improved completely, and that's why I hope anyone do hijama try to be sure that this patient has no either previous tumor or recent tumor. And if he has recent tumor, I should make X-ray, and I only make some points for cupping for immunity, but not over the place of the tumor itself. Can hijama done for children? Of course, there are many indications for the children. I did it for a lot of children, and you shall see at the end of the lecture about some diseases which hijama is very benefit for them. Is it allowed to do hijama above 60 or 70 years? Yes, of course, till 90 years I did. And by the way of this age, I was in England since a few years. I was the head of the medical committee in the Olympic, which was done in England. I surprised that the king, which came to open the ceremony, she aged at that time 86 years old. She is now 97 years old. And I know and I hear from the English doctor that she is doing hijama in England each year. Can hijama be done at any day? Yes, of course. And I think that Dr. Muhammad make investigations with many religion people in Egypt, and the hadith by Prophet Muhammad, which explained that certain days should be used for covering. I think there is no equal or total agreement about these days. And also, as we know, all of us, that hijama is done in China, done in different Western countries without relation to any day. And when I was in China, really each day there was hijama without any difference in the result here. The best position for hijama, of course, it depends on the patient and the position of the hijama. But if we can do hijama during sleeping of the patient, it will be better for him and for me. Can finger and toes be used for hijama? Yes, it is very important. And I hope each one of my doctors and my professors and my colleagues, if they found their patient have very marked numbness in their finger hand, or in their feet, please try to make pricking for the tip of their fingers to expel little few drops of blood. Inshallah, we shall find a lot of result, a lot of improvement in this patient. Can we use hijama in the ear? Again, the ear is very, very important. And I think all my colleagues which studied in China, they know that there is box which explain the position of the point in the ear. And I use hijama. It is not important to put a cup. You can just make bleeding over the point which is related to the problem, and we can make use of this point of the ear. And of course, I am sorry I give this lecture for 3 days in Morocco and Tunisia, but I have enough time, 3 days, for what I am saying. That's why I am very rapid to give you just the important points. The side effect of hijama, they are very little side effect if you take, of course, the cleaning things before and during and after, and let your patient don't eat 2 hours before hijama, and he should drink something directly, some juice after the cupping therapy to avoid any wasting. Can hijama be used on the face? There are very, very, very important points on the face, especially for headache and for sinusitis, even for eye problems. That's why I like to encourage my colleagues in different countries to study the important acupuncture point on the face who can make use of them. I found more than 300 patients got migraine, and they took all the medical treatment and they went to different countries without any improvement. Only hijama helped them. And I think there is hadith by Prophet Muhammad sallallahu alayhi wasallam, ما اشتكى أحد من رأسه إلا أوصاه عليه الصلاة والسلام عليك بالحجامة. This means that anyone has problem in his head, Prophet Muhammad advised him to do cupping. Can anesthesia be used for a patient who is afraid to be alert during hijama? I did it one time only, because one of the theories of the cupping that the patient should feel the scratching, should feel when I put the needle, there is some physiological things happen. It is better when I do the scratches during hijama, the patient is alert who can make use, because there is transmission of transmission to the brain by this feeling of the patient. I did only for one patient who had marked frozen shoulder and he is afraid, and not only of that, because of the pain, to try to move his finger during the anesthesia. How many points can be used for hijama? Yani maximum 10-12 points, there is no problem. But some patients, they have some problem in their bleeding and the clotting time. For me, I put one cup only to make examination. And if I found any problem, I don't complete the hijama. But if there is no problem, I put the other cups. And we use hijama for treating more than one disease, of course, because the majority of patients who came to us, they are chronic patients. They may have cervical pain, lumbosacral, shoulder pain, headache, immunity is decreased. That's why we can apply hijama for more than one point. At the time of the hijama, it depends, no specific time, but the most important thing that 2 hours should pass after the patient eating. The cupping method, of course, you hear there are a lot of things either before or recent, and this is the one. This is the cup which when I was in Nanjing in China, they always use this fire cupping method, and it had, of course, improvement. As the story which I said for the Suji person who came in my clinic, we used fire, but now there are recent equipment, sterilized equipment, we can use them without any problem. All of that, I will leave the lecture with Dr. Muhammad Yusuf, who can make use of anything is written here because of the time. And I hope, and it is hope for any doctor, like to help Islam to approve hijama, to take idea about the acupuncture point. If we use the acupuncture points in hijama, really, 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 inshallah, you will find very good improvement. If we put the cup over the related point to the related diseases, you will find very, very, very important and good results. And especially the meridian of the bladder meridian and the bladder meridian and this meridian. This is in the back of the patient, and there is another one in the front of the patient. More than 100 or 300 patients. We use these two meridians very, very, very repeatedly. I found a lot of improvement in many things, especially these REM meridians. These few points, I use them, these REM points, I use them for a lot of women which does not get pregnant, and they tried many, many things. This point, through cupping with other points in the back, which are the kidney points, they helped a lot by the name of got pregnant. And I hope also, as I said, to study the ear and to know much more the points. We can use the ear either for cupping by, as I said, by needle, and it is very important to expel a few drops. I hope also from all my colleagues to study 2 hours or 3 hours. If you study the hand and you study the foot, it will help your patient very much. And if we like to know, there are many series for Hijama. Many series, a lot maybe said that I didn't hear for thorough the previous lectures, but please try to go back to your study and study hardly the lymphatic drainage. The lymphatic drainage for the upper limb or for the lower limb and the lymphatic duct, you will find explanation of a lot of things, what Hijama do. If you know that each part of your skin is related to a specific segment in the vertebral column, I think it will explain for you why the patient feel improvement if we put the needle or we put the cups away from the site of injury. So please try to go back and to make study of the lymphatic drainage. And by the way, we found that the lymphatic drainage, as all of you know, the lymph contains a lot of debris and microbes which did not enter through the venous system because of their enlargement inside, and they go back through the lymphatic system. So if we put the cups on a special point on the lymphatic drainage, and we help it after cupping by making and explain for the patient to make some massage over the points of cupping from the second or third days. And for myself, I encourage them to buy machine for massage and to make massage for the important points related to the lymphatic drainage concerning their diseases. Really, it will help a lot of patients. So don't forget, please, to make revision for the lymphatic drainage. These some of my colleagues in my study. They are from different countries. Here, when I was in China, in Nanjing, a lot of friends from the United States, from Canada, was studying with me. And I never forget this Chinese doctor who helped me a lot to make hijama over the head of the patient himself, because before that I was afraid to make either needle or cupping for the head, but this one really is very brave and helped me a lot in treating many patients with hijama. This is at the end of ceremony. This is dating back since 1987, I think, or 86 in China. My greeting to all of them, because really they helped me a lot to can obtain many ideas. I will let you see some very important points you can use for your patient. If the patient has migraine or headache in the front of his head, please try to use these 2 points. Of course, if you don't know the name in China, but I will let you know name. And in Egypt, there are a lot of books. They only put marks, yeah, number 1, number 2, number 3, like that. But all the points taken from the Chinese points here. Also, hijama, there are a lot of patients which have psychological problems beside the headache. I always use these 3 points, these 2 points, including the immune point, and plus these 2 points. They are very important in China, and what Prophet Muhammad explained, and also these 3 points. And as you know, I forgot to say, there is one theory which says that hijama is due to stagnation of the blood. One of the Chinese theory, hijama, disease is related to stagnation of blood. And I try to make comparison. For example, if I got patient have right shoulder problem and left shoulder, I put the same cups on the same point on the right and the left shoulder. If he has problem on his vertebra, I put the same cups for example, dorsal L1, L2, and the L4, L5. The same for any disease. This is during my study. I found a strange thing that if I put the cup over the disease point, it gives me more blood than the other cups which is put in another place. And this is really may explain for us why the cup sometimes is filled with blood and sometimes not. Some patient with shoulder problem, if you found, try to make your cups over 2 points, acupuncture point and the tender points. All of this is the syringe which I used in my research. It is very simple. I attach the syringe with the cup and I put here like a needle or something, and I make comparison. I could count the amount of the blood which came in each syringe, which helped me to make comparison between different patients. So this is simple thing. If any one of you are going to make study, he can make use of using this syringe. The people who have carpal tunnel syndrome, all of you know that carpal tunnel syndrome, there is a pressure on the median nerve. Many patients make operation. It is easy operation, but for sorrow, it is recurrent. It may arrive or come back after a few months. I try to make cups for them. What cups makes here, besides the different theories of cupping and acupuncture, removing this blood which was collected over the median nerve, it helps a lot of patients with carpal tunnel syndrome and the same things. So try please. This is me. I was in my clinic and I have severe elbow joint or tennis elbow. I tried many medication, but for sorrow no improvement. And God sent for me this brother. This brother is called Ahmad Hifni. He was studying in Germany. He one of the best Egyptian who did all his effort to make widespread of hijama in Egypt. Rahmatullahi alayhi. He is now in Jannah, inshallah. And really, I swear the God after.
Professor Ali Ramazan, can we
Okay, can you give me
a conclusion in a few?
Okay, a few minutes, please. And again, you will see other things. And this is the bamboo jar which we was using in China. I will let you see at the end of my lecture for the time. Some studies. I collected these studies from different from some magazines, either English magazine or Chinese magazines, and I will let you also see the name. Here, by the way, these are sportive. They are Olympic sportive. and all of them, they took medal from the Olympic ceremony. All of them did hijama, although they are not Muslim, they are from different countries. I think all of you know them. And these are the studies which I hope any one of you in any country like to make research. Please, you can choose anyone. I helped you only to gather for you the most important technique and most important point which can use. I will leave all the lecture with Dr. Muhammad Yusuf. The last things, I have 2 points in 2 minutes. Please, if you find your patient have chronic disease and he did all investigation and nothing approved that he has any organic disease, please, I repeat, please don't forget that there are some diseases not related to organic problems. And in this situation, hijama helped them with Quran. A lot of them improved by hijama with Quran. And we have in Quran ayah, إِنِّي مَسَّنِيَ الشَّيْطَانُ بِنُصْبٍ وَعَذَابٍ. The second thing I like to mention that we should be sure that only one who will help us, he is God who will help us in treating this patient. That's why we should always encourage our patient to be close to their God by praying, by remembering, by everything, because he is the only one. He is the only one. وَإِنْ يَمْسَسْكَ اللَّهُ بِضُرٍّ فَلَا كَاشِفَ لَهُ إِلَّا هُوَ. جزاكم الله خيرا. السلام عليكم ورحمة الله وبركاته.
Thank you very much for your excellent presentation, Professor Al Ramazan.